I'm Geraldine. I come from the south of France and I suffer with multiple sclerosis. I'm going to tell you the story of why I'm here today with you. I was born in the south of France. I've had a normal childhood. I came to the UK in 1999, so about 15, 16 years now. I was 19 then. I got myself a job as a cleaner because I didn't speak any English. So my first hope was to learn English, which I hope I've done well enough for you to understand me today. Thank you. I've got a job for a few years. I was getting on learning the English lifestyle. A few years after, I wanted to earn more money. So in 2003, I got myself a job as a civil servant at Department for Work and Pension. I worked there for a good 10 years. This job for me was really hard because I got to know poverty in a way that is really hard. I got to see people living a life that's just not nice for them, very difficult, a lot of challenges along the way. In my mind, to overcome this, I overindulge in the English lifestyle. That's a lot of drinking, going out, partying, all the greasy food, which I really love. From then, I was about 23, 24, I started to feel odd. I think is the best way I can explain it. I didn't think too much of it, I just thought I'm getting old. In hindsight, at 23, 24, nobody gets old. Well, you shouldn't feel like that anyway. Around about 2006, I used to have pain in my left arm. It was quite horrendous pain. From that, I went to the doctor. The doctor decided it was carpal tunnel surgery. The doctor decided it was carpal tunnel. They advised for me to have carpal tunnel surgery, which I had. It didn't really help, but I did it because they said that's what you must do. From then, it's all a bit of a blur what happened because it has been a good 10 years now. So life went on. But a few years after that, I lost hearing hearing in both my ears. I was answering the telephone in my job, and I found it difficult to hear people. So from that, they sent me for some hearing tests. It turned out that I had the hearing of a 60-year-old, which was good. That's interesting. And I put it down to, again, I'm getting old. It's normal. And from then, again, I just went on with life. We are then in probably in my late 30s, in my early 30s. I used to have a partner then, and he used to put his arm on me during sleep time, and I couldn't stand it. I needed him off me because the pain I used to feel in my arm, it was just draining, it was dull, it was aching, I just couldn't shift it. I used to take painkiller, I used to have horrendous bellyache from painkiller, but nothing would touch the pain. So I was horrible to him, which probably he felt I was hating him, but I didn't. I just couldn't stand having him around me, having his arm on me. So a few months after that, he kept pushing for me to go to the doctor because this was just not normal. I used to wake up in the night, I used to be upset, I used to not sleep well. So I went to the doctor. It took months of me going on and on, saying, no, I'm in pain, you need to do something. They finally referred me to a physiotherapist. I went to the physiotherapist. It didn't really help. I got a lot of exercise. They put it down to doing computer work, because that's what I used to do. It didn't help at all. It was good to do the exercise, so that was ballet. From then on, because I didn't improve in any way, the physiotherapist sent me to the hand surgeon, because by then I developed no twitching in my left hand. The hand surgeon decided to send me to the neurologist because he described my movement as odd. I went to the neurologist. The neurologist said, well, it's probably all in your head. Well, he didn't know what he was saying then, did he? So he sent me for an MRI scan. I had my first MRI scan. I've had a few since, but my very first one I will always remember. It was 45 minutes long. It was too long. I think I must have fallen asleep because there's no way I would have been able to go through 45 minutes without moving. So I must have had a good nap. And actually, this was very welcome because it was the first time in months, if not years, I felt I could rest. Because I didn't have anything to do. I was asked to stay still. Stay still, you fall asleep. So I fell asleep, had a lovely nap, waited. At the time, the result probably would take a few months to come, but I didn't want to wait. I needed to know what was happening because I felt tired, I felt worn out, I didn't want to do anything. I used to exercise a lot, I just gave up on that, just stopped everything I used to enjoy. So luckily, because of where I worked, they were quite flexible, and I was in a city centre in Nottingham. So they let me call the hospital every day to see if they had the result. And one day they had the result and they said they had an appointment available. So I just left my work and I went to get my result. I didn't think anything. I mean, you don't think about anything. I was 30, just turned 30 then, and you really don't think anything like that because I didn't see my life going there at all. So I went to the neurologist, and I don't remember his name, I don't remember his face. I remember a bow tie. He was wearing a red bow tie, really big, and I just kept staring at it. During he was giving me the result, I was like, "What's that bow tie? It's massive." So yeah, he sat me down and he just went through. He showed me pictures, like black and white pictures, and they're all picture of a sliced brain. Well, it's like, but they take the MRI, they cut you from the top down, so you got loads of sliced picture. And he pointed out to some white patches on this picture, and he said, "Yeah, you've got a problem with them white patches." I'm like, "I don't know what you're talking about." I mean, bear in mind, I'm French. My knowledge of English is only of the words that I need to use in my everyday life. I don't really know any medical word. So everything he was talking to me about just didn't make any sense. So then he carried on with the appointment and he said, "You probably have what we call multiple sclerosis." And again, I was like, "Yeah, that must be something, but I don't know what you mean." You know, and he must have stressed that it was important because I didn't feel too happy after the appointment. So I left. I didn't go back to work that day. I went to the gym. For some reason, that's the only place I felt I wanted to be. I knew I needed to call my mum. My mum is a nurse, so she knows a lot about health and things like that. So first I looked up what multiple sclerosis is in French, and if you're interested to know, that is sclerose en plaques. So I thought, oh, I know what that is, I think. I remember my mum, when I was little, pointing out at somebody who had mobility difficulty, and she said, "Oh, he's probably got sclerose en plaques." I'll call her. I called my mum. The phone call was all about 5 minutes. And I said, "Mom, that's what they think it is." And that was it. We didn't really talk about it. It's just a bit enormous, I think. And so I went to do the workout, then had a shower, I then made my way home. I called my mum again. We talked a bit, but we didn't talk about that. we just didn't talk. She said, she asked me all sorts of questions. I didn't have any answer. And I went back to the neurologist after that because they needed to, from the result of the MRI, they needed a more specific neurologist, a multiple sclerosis neurologist. And he gave me an official diagnosis of clinically isolated syndrome of demyelination, and I think the short version is CIS. From that, I went back home, I waited. I didn't really know what to do because I didn't know what it meant. And I went home, I just contemplated a bit, you know, I just sat and just stared into space. I think that's the best word for it. A letter came through the post a few weeks after that, and the letter was that I had 80% chance of developing multiple sclerosis in the next 20 years. And so, oh, okay. Because of who I am as a person, I thought, well, 80%, that is 20% where I'm not going to develop this sort of illness. So I tried to concentrate on that. I then went to France because my mum needed to understand the diagnosis. So I had all the same exams done in France. They were all in French, so she knew what it meant. I mean, it was exactly the same thing because it was the same brain, the same patch, nothing had changed. So, but it was in French, so she knew, my family knew, everybody knew. I think I went in a bit of denial, probably the best word for it, because I just thought, I've got 20%, that's not going to happen to me. It's just not going to happen. Well, I'm not meant for that. I want to do other things. I think it's round about then that I took an interest into complementary therapy. Life went on. I stopped smoking. I used to be a smoker then. I stopped smoking. I ate well. I followed a very rigid plan. I stopped drinking alcohol. I stopped messing around really. And then I started feeling well again. So I thought, oh, it's okay, I've got it. I'm not gonna have this because it's fine, I've beaten it now. So I started all of this again. I started smoking, I started drinking, I started eating all the greasy food. Again, I was bad. And then one day I fell in my garden, my tracksuit got caught on my lawnmower, and then I carried on walking. So I just twisted my knee. That really hurt. As the pain didn't go away, the neurologist decided that I should be seen again. He didn't think I developed multiple sclerosis because the way I appear didn't come across, because I'm quite strong, I stand up. Some people who've got multiple sclerosis are a lot worse off than I am. He then did another MRI scan. A letter came through my letterbox a few weeks after the MRI scan, and the letter was very simple. It was, because of clinical regulation, we can diagnose you with multiple sclerosis. So like, well, I've done well there, haven't I? I remember the date, that was in November 2013. That's 2 years ago now. At the time, I think it's then I made some big choices in my life. One of them was to leave my job, my office job, which some people told me I was crazy to do because I was a civil servant. That's very safe, especially when you've got a health condition like that. They're supposed to be a very safe job. So I left that and I thought, I'm going to set up and I'm going to follow what I'm passionate about, which is helping people be well, being a massage therapist, talking about what's happening here. And that's what I've done for probably, I left in June last year, and I've been setting up a business as a complementary therapist. I also offer beauty treatment. From that, I went on treatment for multiple sclerosis. There were injections, they were horrendous. I've come off them because the side effects were too difficult to handle. I've got to know, as I set up my business, I went into the paper and I talked about it, and a charity called Overcoming Multiple Sclerosis must have seen me and they sent me a book, and I've read the book, and from that book I booked myself on a retreat. A retreat I went to in March this year, and from that I've just changed even more than I had done up to now. I've stopped smoking again now completely. That's it. I've left it now because, well, it doesn't smell great. That's probably the biggest thing, and it takes a lot of your time. It's 5 minutes a cigarette at least. So I've left that. I've learned about meditation. I've learned about and positive lifestyle changes, exercising, gentle exercise to keep me mobile, mindfulness meditation, which is all about being in the here and now and enjoying what you've got. The food choices are about dropping certain items of my diet and having a very rich diet in whole food and seafood, that kind of diet. Then from that, I'm now talking about it because I want to spread the message, because I think people need to know that they can do something, because obviously I stand in front of you today, and the reason I stand in front of you is because I'm following all of that. I'm certain that it's because I follow all of this, and I try to follow what my passion is, which is looking after people.